Okay. Thank you for getting back to us today, folks, to our wonderful event. We have another wonderful speaker for you, Dr. Stephen Crane, who's been practicing dentistry for 23 years. He's what we call a holistic dentist, and he's going to explain to you today what that means, what's different between a normal dentist and a holistic dentist. We're going to find out today from Dr. Stephen. So Stephen, thank you so much for joining us today. We really, really appreciate it. And we're really excited to hear your story and your journey and how you got into being a holistic dentist. So if you could just start by telling people, how you got into dentistry, as a profession, and go from there.
Thank you, Clyde. I appreciate that. And thanks for having me on. Okay,
Absolutely.
I appreciate this. Yeah. So, well, I always knew growing up, I was really medically inclined. I really knew I wanted to help people in that kind of a way. And my brother is an ophthalmologist, and we have doctors in our family, and I thought that it would be really something that I'd love to do. And kind of how I got into dentistry was kind of interesting because I saw how my brother was not only treated in medical school where he had to get they were playing mind games with him in surgery and things like that. And as a doctor, medical doctor, they put in a lot of hours and they're constantly on call. And I said, I really wanted a regular life. Like I wanted a life where I could be with my family and I could enjoy life, enjoy my kids. So I said, dentistry is the way to go. And I really love doing things with my hands. And once I got into the actual practical part of cutting teeth and doing all the mechanical and hands-on dental practices of dentistry, it was really very fulfilling, and then so I became a dentist and I loved it. Had a practice in New Jersey for about 7 years. And then my wife and I decided that we're not going to wait until we're 90 to come down to Florida and enjoy all the perks and
well put.
beautiful paradise. And so I said, let's go and we'll move. And we came down here, and it's been a real blessing. I love Florida. I live in paradise. It's an amazing.
I say that every day.
Right. Yeah.
Yeah.
I mean, it's such a beautiful place. So I love it here, and so I worked for a lot of different places, all around for about another 7 years or so, and I decided, I really need because I had restrictions, a lot of corporate offices. And, I grew up with a general dentist down the street. There was one guy in the middle of town. We go down there, everybody knew each other. And I really enjoyed that experience. I said, you know what, I really want to develop a hometown dental practice. You know what I mean? It's something that you can relate to the people, who people are,
Right.
You know what I mean? You have a relationship with them and you're not just treating them as like a tooth number, you know what I mean? So, I finally, about 8 years ago, I opened up a place in Wellington, and I was there for about 7 years. And then I moved to Green Acres now, by Jog Road in Green Acres. I have an amazing staff with me, and we treat people like people. You know what I mean? Because that's part of being a holistic human being or conscious human being and dentist. That you treat people as people, you know what I mean? It's not like a production line in those corporate places where they're just being, processing people, you know what I mean? And so we give our patients an actual experience. They come in and we treat them with kindness and we nurture them and we talk to them. And I have a lot of people they've come to me and they told me, hey, Dr. Crane, I was really afraid of the dentist. I didn't even want to come to here. And then after being with you for a little bit, I'm not afraid of the dentist anymore, because, treat them nicely, you keep their pain levels low. I spend most of my time making sure the anesthetic is working, everything is in good shape, because once the patient's comfortable, the process itself, is not a real big deal.
Everybody comes into a dentist's office tentative. Because everybody probably has had some time in their life, some tough experiences, so everyone's a little tentative. So it makes a big difference when you walk into a place and it's that, kind of a comforting atmosphere and people are treating you nicely. And really, and smiles on their faces. It makes a big difference to me.
Yeah, good. Yeah, exactly. I mean, we joke around with the patients, get to know them, and it's just it really, it makes my experience so much better. You know what I mean? You don't have all these people. I have people that come in there. Sometimes they're sweating just to sit down. And you see all the damage. I mean, you see all the damage that people have been doing over the years just because of neglect. They don't want to take care of their teeth. And one of the things you learn as a holistic dentist is the connection between all the dental issues and infections and what it can do for the rest of the body. There's been lots of studies on gum disease and heart health, and the more deeper you go into the holistic areas where with the meridians and the Eastern philosophy, you can tell that there's differences in energy. There's just, like those amalgam fillings that people have, those nasty mercury amalgam fillings. Okay. I mean, those things are just, they create so much potential issues.
Is that one of the first things you do with people is get rid of the mercury fillings?
Yeah, it's one of the first things I recommend. Yeah, I mean, we talk to the patient, see what's going on with them, and sometimes if they have infections, that has to be taken care of first. The active acute infections need to be dealt with first. But yeah, that's one of the first things I recommend, because they're just, if you go there, there's this website, it's an organization called the International Academy of Medical Oral and Medical Toxicology, and they have the IAOMT, and you can take a look on their website. They have this smart technique for taking out the silver fillings. It's called Smart Mercury Amalgam Removal Technique, and which is something that I'm certified in. And they go through a series of steps, okay, to safely remove the amalgam fillings. I think it's important that you don't just get them taken out. You have to take them out properly. Okay, I had a friend of mine who ended up had some mercury fillings that she wanted to get taken out, and she went to somebody who didn't do that technique, and it took her 9 months to get her heavy metal readings back to normal.
Oh,
In that process, because the most exposure that the patient is going to get are when they're placed and when they're removed.
right.
Okay, so it's really important how you remove them. It needs to be a very specific technique. And on top of that, I mean, if you take a look on that website, you see they have videos of mercury vapor that just, even when you're chewing, okay, you can see that you're emitting mercury vapor and you're inhaling that. And there's all kinds of things that have been associated with that from like, Alzheimer's type symptoms,
Oh,
kidney.
it destroys the body. It's
Yeah,
destructive to everything in the body. Mercury. It's like
that's
mercury is poison. It's just
right.
like we're poisoning ourselves to have mercury in our body and in our teeth. Like you said, it's like a slow process of death.
Right. And it gives you, and it can create a lot of chronic issues, and
Right.
it's, the issue with mercury too is that it's very, it's pervasive, and it's very difficult because it gets really deep into the cells.
Mhm.
So, I recommend when we do this, you have some testing beforehand, you get an idea of where your toxicity is, because you don't want to add to that. So you want to make sure that you're doing a detox or something beforehand to get that to a place where it's safe to take the fillings out. It's
Do
really
you
important that it's done in a proper sequence.
do you recommend regular detoxes for everybody anyway? In terms
Well,
of
I do.
poisons and
Yeah,
things?
I do. I think they're important. I do, I do juice fasting. I do, regular detoxes. Sometimes colonics, things like that. I think it's important because our environment and our food. I mean, we're just deluged with all kinds of toxic chemicals, and it's really important to keep our body as clean as we can. I mean, that's one of the reasons that I'm a vegan, is that I think that all meats and fishes and stuff, there's a lot, it's all toxic for you,
But they've been fed what they've been fed. We're eating.
Yeah, absolutely, exactly right, and
Pesticides get in, all the stuff from the pesticides, the GMO.
oh, absolutely, 100%. Yeah, and there's been some documentation of I don't know if you ever heard of Dr. Jeffrey Bradstreet. He was a
Yeah.
doctor in Tampa. He's he's not with us anymore, but that's the story for another day. But well, he showed a link between the glyphosate from the Roundup,
Mhm.
that it really disables our what's called our GCMAF, which is it's a macrophage activating factor, which marshals all the immune system to attack viruses and bacteria and things like that. And he saw that there was a link between that becoming deactivated and things like autism and Epstein-Barr and herpes and things like that. And
Right.
and so it's a neurotoxin, and it accumulates. So
Right.
I mean it's similar. That's why I don't have fluoride in my office. I don't believe in fluoride because it's a neurotoxin, and it accumulates. I mean, if you take a look at, it's interesting because if you take a look at the toothpastes for toddlers,
Hmm.
you'll see that there's no fluoride in it.
Hmm.
So fluoride is so good. Why don't they have in toddlers? Because they know they're going to eat that. They're going to consume a lot of that, and they're going to get sick and have a problem. You know what I mean? So why they put it in
The regular
for
adult
adults?
toothpaste.
Well,
That's
that's
yeah,
that's a
yeah,
difference. Yeah.
yeah,
It's a question for them.
yeah, yeah,
So,
yeah. Well, it's good to make people aware of it because most people aren't aware of these things. So that's part of what you're doing, right? I mean, you're educating your patients, and not
absolutely,
just
absolutely.
not just the mercury in their teeth, but also just what they're putting in their body. And
Absolutely. I have conversations with my patients all the time about their diet.
mhm,
I mean, it's just you see, and it's a very interesting thing because a lot of the things that are bad for us are very addictive. And people don't want to give. Oh, I'm not giving up my dairy. Oh, I'm not giving up my meat. And it's like, look, nobody's trying to deprive you of anything. It's just that this stuff is making you sick. So it's better to stop taking things like that.
it
I
comes
mean,
down to
it's
acid and alkaline, right? I mean, you want an alkaline diet. Dairy is extremely acidic, and red meat is very acidic. So
absolutely, absolutely makes a
those are the things
huge
that are going to
difference.
get you right.
Makes a
Right.
huge difference. Yeah, and there's and dairy has a protein in it called casein, which emulates endorphins in our brain. So it's a happy food.
Right.
People don't want to give it up because it's a happy. Oh, it makes me feel good. Yeah, I know,
It's
but
addictive.
it's killing
It's
you. Yeah,
addictive.
it's
Yeah.
addictive.
Yeah.
Exactly right.
Yeah.
It's like a drug.
Yeah.
100%. 100%.
Well,
So I talk to people about that all the time, about their diet and how they, like exercise, and giving them little tips. When I do process, I tell them different supplements, different vitamins, different, essential oils that they can use to help with their treatment before and after. These things are part of being, I think, a holistic dentist.
I
It's
think
not just
people are getting the idea. There's a big difference from their typical dentist going to a holistic dentist. And I think this is just very, very profound for people to hear. I wanted to ask you a question. I had some root canal work done with my dentist, and I can't remember what the substance was, but there's some substance that most people in America use, most dentists use,
Mhm.
that is not good. And very few dentists in America don't use that. And Canada, they don't use that. And so my friend, who's my dentist, also my golf partner, he he has a source to get what the Canadians use instead of what we use in this country. I can't remember what it was. Does that make any sense to you? There's something in the root canals that you do that they normally put in that's not good for you. Are you familiar with what I'm talking about?
Well, I have some familiarity. I don't know the exact substance you do. I mean, the substance that we were using is called gutta percha, and it's a rubberized material from the neem tree. It's from the
Right.
bark of the neem tree.
Oh, well, I think that's what he was using.
That's
Yeah.
that's yeah. Well, but that's standard. Actually, that's
Okay. Is
standard.
that standard now? Okay, good.
Yeah. There was like 50, 60 years ago, there was a thing
Mhm.
called Sargenti paste, which was very toxic for the bone and stuff. And even the American Dental Association said, stop using that.
Okay.
It's not good for you.
That might have been what I was thinking about, because
Yeah. So that, yeah, that's
my root canals were a long time ago, but I remember them.
yeah. That's they can be memorable.
Yeah, it's not
Unfortunately.
something I want to do again.
Right,
So,
absolutely,
right,
absolutely.
right.
Makes a difference.
Yeah.
Yeah,
So
very good, man.
what do you do for pain? How do you do that?
For
You know,
example,
yeah,
what
well,
do
I
you mean, like
mean,
dental
keep,
pain or?
yeah, I mean, for keeping the pain down. What do you use for pain, keeping the pain down?
During a procedure you're talking
Yeah,
about?
during a procedure, yeah.
Oh yeah, well I have a compounded topical anesthetic, kind of like an Orajel kind of thing that I get compounded, so it's stronger than
Mhm,
most.
mhm,
And then we put that on the gum tissue, and then we give. I have I use it's a Novocaine style.
mhm,
It's called Septicaine,
mhm,
um, or Articaine hydrochloride, which is a very profound anesthetic, and it works really, really well
mhm,
under most circumstances. Obviously, you have to take the health history into account because there's epinephrine in that. You know what I
mhm.
mean? And I use one that has a lower epinephrine than typical.
Okay,
And
okay.
that,
That's
yeah, and
that's
that
what I
works.
was going to try to get to. That I know there's some ways to kind of reduce the toxic aspect of those things. So you're doing that as well.
Right, right. And I do have, for medically compromised people, I have a special non-epinephrine
Mhm,
um, anesthetic. The only thing with that is it doesn't last as long, so you have to give more of that.
mhm, mhm, mhm. That's awesome.
Yeah,
So,
and people have been very, very happy with that. And we have a technique while we're getting people numb, where we tap on their shoulder as I'm giving them the injection,
mhm,
and what that does is it's a distraction technique that a lot of people find comforting, and that they say it makes a difference in the actual injection, because that should be okay. The most painful part of the process is just
right,
the initial injection, because it's a prick to the skin.
right.
So that, yeah, so that helps dampen that. Okay, and a lot of people are saying, "Wow, I didn't feel a thing," which is really great. It's really
Yeah.
great. So we try. I think you do as much as you can. Okay, to help the patient have a process and an experience that's going to be good. You need people coming back and taking care, just like, you need people going to the doctor to check their health. And, people need to get their teeth taken care of, and we need to take away the barriers for people.
Exactly. You don't want people to resist coming, because if they resist coming, then they're not getting their teeth cleaning and they're not getting the other things done that they need to get done and to keep
Right.
healthy teeth.
And, yeah, and
Yeah.
the repercussions could be pretty bad, as far as, if they let them go.
Yeah.
I've seen people with really just very destroyed teeth, a lot of gum and bone disease, things like that. And another thing that I want to mention that I do, as far as like when people have periodontal disease with, like, gum and bone infection, besides the fact that they need to be coming more often, because they're at least it sets up, the bacteria get around the gum tissue, and they start breaking the strings that attach the gum to the tooth and the gum to the bone, creating what they call a pocket, which is basically, it's an area of the gum tissue that's not attached to the tooth, and the bottom of that, where the bone is, they can't reach with anything they have in their home. So they have to come more often to the dentist to come scrape that out and get all the bacteria and things out like that. But what I've been noticing is I've been telling my patients to do what they call coconut oil pulling. Actually comes from Indian medicine, and it pulls out the toxins and from the gum tissue. And after about 7 to 8 minutes or so of rinsing with or swishing with the coconut oil, becomes naturally antibacterial. So it mixes with the
Oh.
saliva, and it becomes a natural. So instead of using those over-the-counter
Mhm.
medical, antibacterial rinses, I tell patients to do that once or twice a day. And it's really important that if you're going to do that, that you spit it in your sink. Spit it in your garbage, because it'll ruin your sink. So make sure that if you're going
Really?
to do that, that you spit it in the garbage. Yeah. But I've seen some really great results where
Is
people
this
come in and they're,
what kind of coconut oil do you use for that?
well, that you want the cleanest you can get. So you want non-GMO, you want organic,
Right.
you want, if you can get cold pressed, that's great. And you want unrefined
Okay.
coconut oil. Yes, you want just the cleanest that you can get. And it's I've
Amazing.
seen,
I'd never heard of that before. I didn't know coconut oil had that cleansing effect,
hmm,
you know?
right. So it's just things like that. People are like, oh, really? I've never heard of that. And I've seen people with much better, their gum tissues are in much better shape
Mhm.
when they come to see me the following time, if they've been particular about getting that taken care of that,
Do you work
So
with a lot of children in your practice?
sure, yeah, I have a family practice, so I work with
Mhm.
children, I work with adults and seniors, and see a little bit of
Right,
everybody.
right.
Yeah,
And
and I do.
yeah, go ahead. I was just gonna
Yes,
say, in terms of diet with kids, I mean, you try to explain to the parents that the damage is sugar, refined sugar, and all
of
that kind of.
course, yeah, of course, yeah. It hits home the most when they say, "Oh, you got cavities." That everybody knows that cavities and sugar, yeah,
Mhm,
are it's a causative effect. So then I can open the conversation and say how bad it is for sugar, but like, it's also very addictive, and
mhm.
a lot of times the kids get rewarded by, "Oh, I'll get you some candy if you do the right thing," and so it's sometimes hard to really kind of change that habit in
Right,
people, but it's very, I do have the conversation,
yeah.
and
Well, it's
but
nice now because like ice cream, kids all always love ice cream. There are
Mhm.
so many alternatives now out there
You're
that
right.
they're not using sugar in their ice cream, like Cotto. Cotto is one of my favorites. It's actually
Okay.
based without, it's not dairy, no dairy, no
Mhm.
sugar.
Right. Right.
I think they use stevia for
Okay.
the sweetener,
This
which
week,
is
yeah.
not bad, right? And
Nope.
then and
Natural.
then and there's no dairy, and it's delicious.
Yeah, there's some coconut. I forget the brand. We use some like coconut milk ice cream that we have here sometimes.
Yeah, I use that
It's
too.
amazing.
Yeah.
It's really amazing stuff. But I just wanted to kind of say that, I also have, as far as what I offer in my practice, I do zirconia implants, which are which are safer than the titanium implants. I do both types, but the
Mhm,
zirconia is the safer of the two.
mhm,
I do everything metal free, so the crowns are metal free. I can even do metal free dentures.
mhm,
Which are sometimes if you're to pull teeth, if they have the bad root canals or things that you're taking them out, they need to replace their teeth so they can chew and eat, and have a good
right.
diet. So that's also something that I offer, and I do a myriad of things. I was trained in a lot of different things, anywhere from the clear aligners and braces, and I do the white fillings, I do crowns and bridges, and just basically I do extractions and all kinds of things. And also when you're getting extractions, what's important is, that, holistic or conscious dentist, when you're taking a tooth out, you really have to make sure that all the tissue that's in the bone, there's a ligament that attaches the tooth to the bone called the periodontal ligament.
Mhm,
And it's really important that you take and scrape all of that out of the bone, because you can get some
mhm,
repercussions down the road with some persistent infections in the bone, and that can cause some problems too. So I
mhm.
think it's important that that the person you go to has some insight in that as well.
You mentioned braces, and a lot of people when they get older, your teeth start to push in. And I had that down here.
Hmm.
And at age 65, I had my dentist put braces on. I wore braces for a year at 65. I
Yeah,
got some weird
yeah,
ones.
yeah. No, I have a lot of
You know,
adult
but I
patients
am
with it.
so glad I'm just want to say, I'm so glad that I did it. It was really annoying. I mean, really annoying. But I am so glad that I did it because now my teeth, are much better,
Hmm.
and it's easier to
Right.
take care of. And I'm just glad I did it. So I just wanted to throw that out there. People are I'm 71 now. I got the braces at 65. And
Hmm.
I wear retainers every night. But
Yeah, I
this
was
is
going to say,
this
good,
is
good.
this yeah, part of the routine,
Yeah, yeah, it's
part of the
very important. The retention is the biggest thing. I have so many repeat braces. People, oh, I've had braces when I was younger, and then now they're adults, and they have similar issues as you. I mean, they didn't keep their retainers. They don't wear their retainers, and it's really something that's very important in order to keep everything stabilized. It's
I
our
can't
teeth.
it's hard to think about. It's hard for me to realize that somebody would do that when they're older because there's no way I want to go through having braces again, So I
Yeah,
wear those retainers,
right.
I don't miss a night, without the retainers.
Right, right. Well, it's smart. This, you're a smart guy, and that's appropriate, because that's the only thing that's going to keep them in place. Because we have our teeth and our gums. They have memory, and they're going to want to go back to the way that they started.
Mhm. Yeah.
You know,
Oh, yeah,
so,
they
yeah.
do. I mean, if you miss, you can tell that they're going to move back.
Right. Yeah. Yeah. Just go. You go one night without retainer. You put it on the next day. You can feel it's like, wait,
It's a
it's a little snug now. Yeah.
yeah,
Yeah.
it's
It's
harder to get it on. Yeah. Yeah.
yeah.
Absolutely.
100%.
Yeah.
Yeah, so there's good, also there's some good alternatives nowadays for stuff like that. If you have just minor movement on the lower, you can do the Invisalign style. There's clear aligners, they're called, and so they're less obtrusive. You know what I mean? If people are a little
Right.
bit more willing to do that type of a thing as an adult. But yeah, and there's also we have clear brackets too, so that all you see
Right.
is a wire. So there's
Right.
yeah some alternatives to that to
Yeah.
make it a little bit less conscious for the
Right.
for people wearing
Right.
it.
Right. Well, I can see your full service. You do everything, you know?
Correct. Yeah.
Yeah. Yeah. Yeah.
Yeah. I think
So,
it's important. I think it's important. That I kind of started that. I was working with some corporate places and they were oh, you can't do root canals because I have a root canal specialist. So you can't do extractions because I have an oral surgeon on staff. So you have to refer it to them. And
mhm,
I'm like, sometimes these people don't come around for a month for the
mhm,
office. I'm like, I'm going to let some guy, with an infection in his teeth because you don't want me to do a root canal or do something to help clean this tooth up.
mhm,
I'm going to let him wait a whole month before he gets any kind of relief. I couldn't bear to do that to patients. So like I wasn't very popular
right.
because I would I actually had
Right.
one place that I was working for. He stopped buying me any kind of root canal stuff because because if I had it around, I'm going to try to help the patient. So
Right. Right.
yeah.
Well, that's awesome. It's obvious that you're really dedicated to this I guess cause of health and holistic health with your patients, and it's more than just what they do with their teeth. It's what they put in their body,
Mhm.
and I know you're trying to teach people all the effects of what they put in their body and the effect it's going to have not only on their teeth but their overall health. And I
Absolutely.
think I think people have gotten a pretty good picture of what a holistic
Yeah.
dentist is by talking to you. And it makes a big difference. It's a part of it. A big part of our health is our teeth and our what's going in our mouth, and how healthy that is and what we put into it, and what we put into these amazing bodies that we have that
Absolutely.
will last for a long time. I
Hmm.
am so into this longevity thing now. As the older I get, the more I'm into it. And my hero is Robert Marchand, and he's in Paris, and he's 110 years old, and he still rides his bike. He's a biker, and
Wow.
he competes in biking, and his doctors over there are amazed because they have found out, and they study him, that even at that age he is getting in better and better shape from his conditioning routine, his exercise, and his diet and everything. He's very
Hmm.
much into his diet and everything. So I mean,
Absolutely.
we can live healthy, active lifestyles until a very long age if we take care of ourselves.
Amen. Yeah.
You know,
Absolutely.
so it's an amazing revolution that's taking place, and people are finally starting to realize that food really is medicine, which is
Hmm.
what Hippocrates said. Medicine is food, and food is medicine. And
Yes.
what we put in our bodies will determine what kind of a life we live.
Yes.
How the quality of life that we live, and the age. How long it lasts
Right.
go hand in hand. Obviously, you don't want to, like my father-in-law lived 7 years with Alzheimer's, where his life was horrible, and it was horrible
Right.
for her mom for
Mhm.
seven
Right.
years, and that's not living, you know.
Right. Right.
And so you want to avoid that, and we can avoid that if we watch what we put in our body and our exercise and everything we do. So you know,
Absolutely.
it's an amazing transformation taking place, don't you think?
I do. I do.
Yeah.
And I see, and it's cool. It's a lot of the young people are kind of more in tune with it than you see that I see a lot of young people, and oh yeah, I'm vegan, and I've become a vegan. Oh yeah, I know, they're more receptive to it,
Yeah,
and they understand. They're actually, the one cool thing about the internet is that you can kind of get a bunch of information, and people can start being educated and how to better take care of themselves, and hopefully make better decisions for their lives.
absolutely. Can you
That's
tell everybody how they can find out about you? And you have your website and anything else, social media or
sure.
anything you want to let people know so they can get a hold of you?
Yeah, but that's one thing that I'm not a huge social media guy,
Okay.
uh, but it's I do have a Facebook page. Don't use it that much, but it's basically my address is 2926 Jog Road in Green Acres, Florida 33463. The phone number is 561-798-0825. And it's Stephen Crane, DMD. PA is the actual name of the business. Um, and you
Okay.
can find me there. You can look me up on the internet, and you'll see. And thankfully, we have good reviews, and our patients are really happy. And like I said, we treat people like human beings, and they're human beings first, and they're whole people. And that makes a difference. I mean, we get a lot of
You're in
thankfully
Boca,
a lot of.
right? You're in Boca, correct?
Well, I live in Boca, but I practice in Green Acres, which is near Lake Worth.
Oh, okay. So so is it in Lake Worth then? So if they look
Yeah,
up Dr. Stephen Crane in Lake Worth, they
yeah,
were
either Lake Worth or Green Acres.
okay. Okay.
Like I don't know if you, I don't know, you remember
I'm,
that the TV show Green Acres.
oh yeah, yeah, that's right.
Yeah, yeah, yeah. So,
Okay.
but yeah, Green Acres,
Okay.
Florida, and they can look me up, and um, that's some stuff. I mean, I'm in a process of kind of revamping my website, things like that,
Okay.
changing some things. So that might be a little bit challenging up there, but
What is your website though, in case, because you will have it up at some point, right? What's,
yeah, yes, I will. I will. Well, I'm still in the process of figuring that out. I
oh,
mean,
okay. All right. So
so,
if they
so
do a
yeah,
Google search on Dr.
I do
Stephen
Google
Crane,
research.
Green
Yeah, yeah,
Acres,
they'll
they're going
find
to
me.
find you,
Right,
right?
right,
Yeah.
absolutely. Yeah, yeah,
All right. All
hundred
right. Well,
percent.
you have any last takeaway you want to give to people before we go? Any of in terms of what maybe the most important thing they can do in terms of their overall health and teeth and everything?
Well, yeah, it's not one simple thing, but listen, be conscious. Like read everything before you eat it.
Mhm.
Make sure that you're going to see your dentist and your doctor regularly to make sure that your health is good. I think, like Clyde was saying, what you put in your body is the most important thing that you can do. So really be conscious. Take a look. I mean, it's once I became vegan and I started reading every little ingredient before I put it in my mouth, you'd be surprised what they put in stuff. Like I don't eat anything with corn in it because all the GMO stuff like that, and I really don't think.
Soy, same with soy.
Same with soy, right? Exactly. So this is, you take a look, because corn is still a subsidized product,
Mm.
so it's cheap. So there's corn. They put corn stuff in everything. I mean, they even put cornmeal in. I even with it for my dog. I even make sure
Corn
that there's
syrup
no
for
there's
a
no corn,
sweetener.
corn
It's all
syrup.
GMO, all GMO.
100%. So it's really, pay attention to what you're eating. What
Yeah.
you're putting in
And
your
and the
body.
fluoride in their toothpaste too, make sure, because a lot of times people don't realize they're buying a toothpaste and you have to look and see.
Yeah,
I get Tom's toothpaste at Trader Joe's, but not all of the Toms is free of
right.
fluoride. You
Right,
have to
exactly,
pick the right
exactly. Yeah.
one.
100%. Yeah, I like Spry is a really good one for me. That's it's pretty simple ingredients, and it's a xylitol base. There's no fluoride in it. That you can get that at Whole Foods as well. There are a few do. I think Jason's makes one. You just really like I said, anything you're putting in your body, take a look, read the ingredients, and make sure there's nothing funky in there. It's got to be more particular about what we do, because people making these products and making these food items, they're really not as concerned with your health as you would expect them to be.
Yeah.
So
Yeah.
you got to take care of it yourself. You got to be
Yeah.
conscious and mindful for yourself.
That was a very nice way to put it. We've been keeping it very nice today,
Yes,
but
yes.
But you know, the thing is that everything you've said is very, very helpful. I think this has been a tremendous interview, and it was, you know, everything I expected it to be and more. So thank you very, very much for taking your time on a Saturday morning,
Mm.
you know, to visit with me and share this with everyone watching. So we really appreciate it.
Thank you, Clyde. I appreciate that.
Okay,
Thank
enjoy
you.
the rest of your day. Enjoy
Thank you.
the
You as
sun,
well.
the beautiful sunshine.
Yeah, I'm gonna go out for a walk.
Okay. Thank you everyone for joining today.